My name is Viviana Barboza, and this is my presentation on HIV, human immunodeficiency virus. The pathophysiology of HIV is a gradual destruction of the naive and memory CD4 T lymphocyte populations and is the hallmark of HIV-1 infection, with AIDS being the last disease stage. One mechanism HIV weakens the immune system is by infecting and destroying these CD4 plus T cells, which in turn leads to immunodeficiency at later stages of disease. HIV attaches to the CD4 plus protein on the surface of these and other cells to gain entry. However, the presence of CD4 plus molecules alone proves to be not enough to allow viral entry into other cell types such as monocytes and dendritic cells. Therefore, a second doorway is needed for the virus to gain access to infect cells. This led to the discovery of the chemokine receptor as essential co-receptors for HIV-1. There are different types of these co-receptors for different cell types that HIV variants can use for infection of cells. Two main chemokine receptors have been identified that play a major role in HIV entry are CCR5 and CXCR4. The stages of HIV. If HIV is untreated, a person can progress through 3 stages of HIV. Medicine to treat HIV help people at any stage of the disease if taken correctly and as prescribed. People with HIV who are taking the HIV treatment and keep their viral load undetectable effectively have no risk of transmitting HIV to an HIV-negative partner. The 3 stages of HIV are 1. Acute HIV infection, 2. Clinical latency, 3. Acquired immunodeficiency syndrome, or AIDS. Stage 1. Acute HIV infection. This stage takes about 2 to 4 weeks after exposure to HIV for symptoms to present. This stage is when a person is highly contagious, but usually unaware that they are infected. Flu-like symptoms occur during this stage, which are the following: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Diagnosis of stage 1 is made through 4th-generation antibody antigen test or a nucleic acid test, or the NAT test. Stage 2, clinical latency. This stage, also known as chronic HIV infection, is still an active infection, but replication is occurring very slowly and patients may not have any symptoms. If medication is being taken as prescribed, this stage can last many decades. But if patients are not taking medications, they can progress through this stage fairly fast. This stage is still contagious, but less likely for those patients who are taking medications and keeping the virus suppressed. Viral load of the virus increases during this stage and the CD4 plus cells decrease. Stage 3, acquired immunodeficiency syndrome, or AIDS, is the most severe phase of HIV. Severely immunosuppressed patients during this stage acquire many illnesses, known as opportunistic illnesses, which otherwise would not go to a patient who is otherwise healthy. Patients not taking medication usually survive about 3 years in this phase. Signs and symptoms: recurring fever and sweats, extreme fatigue, rapid weight loss, prolonged swollen lymph nodes, memory loss, depression, neurologic disorders. Treatment of HIV. Antiretroviral therapy, or ARTs, decrease the viral load and can be undetected. There is no cure, but ARTs slow the progression of the virus in a person's body. According to the U.S. Department of Health and Human Services, treatment should be started as soon as possible following diagnosis. Side effects of antiretroviral therapy are nausea, vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain. Side effects usually last a few days or weeks, but today's medications have fewer side effects reported. Treatment of HIV continued. Getting and keeping HIV under control is the best thing people living with HIV can do to stay healthy. Another benefit of reducing the amount of virus in the body is that it helps prevent transmission to others through sex or needle sharing and from mother to child during pregnancy, birth, and breastfeeding, known as treatment as prevention. Monitoring of HIV. The CD4 count. Normal is 500 to 1500 cells per cubic millimeter of blood. Levels below 200 cells per cubic millimeter of blood puts patients at risk for infections. The viral load test measures the amount of HIV's genetic material in a blood sample. The results of a viral load test are described as a number of copies of HIV RNA in a milliliter of blood. Pre-exposure prophylaxis. Pre-exposure prophylaxis, also known as PrEP, is a way for people who do not have HIV but who are at substantial risk of getting it to prevent HIV infection by taking a pill every day. When someone is exposed to HIV through sex or injection drug use, these medicines can work to keep the virus from establishing a permanent infection. PrEP continued. When taken consistently, PrEP has been shown to reduce the risk of HIV infection in people who are at high risk by up to 92%. When taken effectively and consistently, PrEP is effective. PrEP is a powerful HIV prevention tool and can be combined with condoms and other prevention methods to provide even greater protection than when used alone. People who use PrEP must commit to taking this drug every day and seeing their healthcare provider for follow-up every 3 months. Transmission of HIV. Antiretroviral therapy can decrease the amount of viral load in the body, and taking medications as prescribed can keep the viral load undetectable. If the viral load is undetectable, there is no risk of transmitting HIV to another person via sex. Mother-to-child transmission. The risk of a baby acquiring HIV is 1% or less if the mother takes the HIV medications throughout her pregnancy, labor, and delivery, and if the baby is given medication for 4 to 6 weeks after delivery. It is unknown if HIV can be transmitted through breastfeeding. Patients living with HIV. The healthcare teams for those living with HIV include a primary HIV healthcare provider, which can be an MD, an NP, or a PA, pharmacists, nutritionists, dentists, substance use specialists, social workers, case managers, and patient navigators. HIV treatment is most successful when patients are actively taking part in their plan of care. Patients need to take HIV medications as prescribed, keep medical appointments, and follow up with primary provider and communicate openly and honestly. Patients living with HIV continued. Patients should use appointments to ask questions or bring up any concerns that need to be discussed and addressed with the provider. Patients should keep track of their lab results, keep track of their medications and their scheduled times, keep their appointments, and discuss the treatment plan with their provider at every visit. Health and wellness. People with HIV may have issues affecting nutrition, such as changes in the body's metabolism, medicines that may upset the stomach. Raw meats and fish may also affect antiretroviral therapy. A healthy diet offers several benefits for patients living with HIV. It provides energy and nutrients to help the body fight HIV and other infections. It manages the HIV symptoms and complications. It also improves medication absorption and helps manage possible side effects. Exercising can also increase the strength, endurance, and fitness and help the patient's immune system to work better to fight infections. Here is a list of all the references used for this project. I hope you enjoyed this presentation. Thank you.